As a scheduler, or any time that you are trying to get a patient to schedule, it is important not only that the patient have the right intention for scheduling, which a lot of times they don't, that you have the right intention for scheduling. So this video is specifically talking about purpose and intention when it comes to getting patients to schedule, okay? We don't want to try to get our patients to schedule because when I mean schedule, what I'm saying is they need to schedule their next appointment. Okay, everybody leaves your appointment with everybody leaves your office with their next appointment, whether they're leaving and they need another appointment with a doctor, or they need a perio appointment, or they need their next recare appointment 6 months from now. Everybody should leave your office with an appointment, okay? Now, for you, you have to believe that. If you're just trying to get the patient to schedule because it's your office policy, because it's what your office manager told you to do, you're probably not going to get a lot of patients to schedule. You have to really truly believe that it's important that the patient schedules their next appointment. So I wanted to talk about that in this video because as an employee of your team trying to get patients to schedule, you need to know what the benefit is. Why do I really care if the patient schedules their next appointment, okay? So first of all, it's best for their dental health. We are the only people, the dental team, your office, who looks out for the patient's dental health, okay? And there's a ton of research out there about mouth and body connection, so it's their overall health. But nobody else is really looking out for their dental health. They don't go to the doctor and have their teeth checked. Their teeth don't get checked when they go get their nails done or their hair done. Only we make sure that they're stable and healthy when it comes to their oral health. So that alone is super important to make sure that you understand that and you realize that patients' dental health is your responsibility and that we do need to see them every 2, 4, 6 months for their next filling or whatever the case may be. Now, we're their healthcare professional. We're their healthcare providers. We help our patients keep their teeth longer and live a better life, okay? But in our patients' minds, what we offer them are appointments at the dentist where they have to get drills and needles in their mouth. They have to pay money. A lot of times their insurance doesn't cover 100% of it. A lot of patients don't like to come to the dentist, so they're going to always push back when it comes to scheduling their next appointment. We have to be more persistent than them. We have to make sure that we're looking out for their dental health, and even if they're pushing back, we have to understand why they do that. We're not their favorite place to come. They would rather go, shopping or to a new restaurant or a movie any day over coming to the dentist. So we need to understand that. And when you're really trying to get a patient and help them and get them to schedule, you need to understand what your purpose is. And it's really to make sure we take care of the best we can, we take care of our patients, okay? Another important reason to pre-book your patients is people get busy. You look at your schedule. Think about the last time you were gonna, you take your car in to get an oil change, or you thought about starting a new workout plan, and now it's 3, 4, 6, 8 months later and it hasn't happened, right? Same with patients. We had a patient call in recently and she said, you guys have been trying to call me to get me scheduled. I was just in there 6 months ago. I looked in her history and she hasn't been in 18 months. So it's been a year and a half since she's been in, not 6 months, and she didn't even realize. So people get really busy. If we don't have them scheduled for their appointments, life happens. And it's 6 months, it's 9 months, it's a year, it's 18 months. And we really need to make sure that those patients are scheduled so it doesn't go that long, okay? The next reason is that people are easier to track down when they're already scheduled. If we try to track them down and they don't have an appointment scheduled, the chance of them calling us back to schedule that appointment goes down quite a bit. If somebody has an appointment scheduled, then they're going to call us. Even if they can't make that appointment and need to move it, they're going to at least call us back, because most people, good people don't want to, not show up for appointments they made. They don't want to, cancel last minute typically. So getting a patient to schedule will at least give them the incentive that 6 months from now, when we're trying to confirm them, that they will call us back to have to move the appointment or have to, whatever the case may be. But if we don't have them in the schedule, they're going to think, oh yeah, I'll call them when I have time, and another year is going to go by, okay? So it's easier to track patients down when they're already scheduled. All right. Now, the last thing to think about is just the fact that patients prioritize things that they like. They would rather go get their hair done. I mean, it's harder to get in with a hairdresser than it is with a dentist. They would rather go shopping. They would rather do anything else than probably come get their teeth cleaned. There's very few patients of ours who are excited to come in and get their teeth cleaned. And we need to understand that. We need to understand that our persistence, our interest in really helping them, our reasoning for kind of pushing a little bit and saying, listen, let's just get your appointment scheduled now. I know that you're busy this week. Let's get you scheduled next week. I understand you're going on vacation, so let's get you scheduled as soon as you get back. I know you don't know what's going to be happening 6 months from now, but let's get you scheduled and we can confirm it with you then, and you can, put it in a time that works for you, is much better than just going, oh, okay, well, just call us when you're ready. Because that purpose or intention is just to be friendly with a patient and let them go, and it's not really helping our patients in the long run. So hopefully with this video, you can kind of get some reasons and examples. You have to use your own verbal skills. I mean, I'm not big about scripts. I'm not telling you exactly what to say, but really understand that your job is to take care of your patients and their oral health. And the best way to do it is to get them scheduled for their next appointments, because if we don't, the chance of them seeing them when we need to see them goes way down. And we can't help them if they don't show up. We need the patients in the chair in order for us to help them stay healthy. So make sure when you're trying to schedule the patients that you're thinking about this, and make sure that you're persistent, because if you're helping a patient and you understand it and you're not just doing it because it's the office policy, but because you truly care about the patient in front of you, I bet you more times than not that patient's going to go ahead and schedule the appointment because you cared about them enough to be a little bit persistent to get them to schedule their appointment.